And I think what you've also mentioned was about the sampling size. So, Dr. Anna, would you like to elaborate a little bit upon what is a sample size that you would like to have for a given survey?
Right. So this is always the much hyped question, be it any kind of a survey, right? What is the sample size? So again, it depends on the purpose of the survey. It depends on what kind of a survey you're doing. Again, I take the example of patient feedback because that's a very common survey we do. In this case, that opportunity has to go to every patient because that is the intent of the survey, rather than so that you don't miss out on any feedback, relevant feedback that you need. Secondly, it's part of the patient rights to ensure that they are able to give their feedback. However, there are other surveys that we conduct. For example, employee satisfaction survey. I would say that every employee should get the opportunity to give back that. Maybe employee awareness survey, another survey that we do. May not be possible to get every employee involved, so you need to do some sampling. Now, whenever we do sampling, we use this word random sampling, which is very random in itself. I would always say it should be random stratified sampling, meaning a representative sample of the population we have to ensure is there in that group that we select. Normally, we follow the 20% rule, that is, at least 20% of the total population should be included. But again, as I said, this is always an area for debate, which I have seen in many of the hospitals that we capture patient feedback. We are not getting all the feedback, but we always try to counter that argument by saying the opportunity is given, but it is the patient's right if they want to give the feedback or not. However, we need to look at intelligent strategies to increase that number. That's of course a set thing. But the sampling technique, as you asked me, it would always help to do a stratified random sampling and ensure we have 20% or more of the target population.
Right. Great. And if it is a small population, then it would be an entire population, 100% sample collection that you would prefer to do. Any additional comments, Dr. Suvin, on this?
Yeah, I think it's right because we don't, when we are talking about public surveys, we are not sure of the response rate. So the response rate has to be worked up by the surveyors or the team which is doing it to improve on the response that comes out. So based on that, most of the literature talks about 50% or 60% non-response rates. So we are looking already with a handicap of only 40% that can be possible. Even there, we cannot force on in various stakeholders to give us the feedback because it's their prerogative to give the feedbacks. If you have a captive audience, you can possibly get 100% or 90% of the surveyed response. But if you're talking about external stakeholders, you may possibly end up getting, as Dr. Anna said, possibly 20%, which is in most circumstances probably not possible, but still you can always aim for it.
I would like to add to this, Dr. Vasundhra, that the most intelligent way of doing it would always be to go to a statistician because
let the experts help us.
Yeah. Let the experts
they work out. Yes, they do a wonderful job working out what is a statistically significant sample, so that you can always pick that up and use it for an evidence if anybody questions your methodology.
Absolutely, that's great.
Very true.